Are you looking to get on the road to your dream career? You're in the right place. Welcome to the Mentor Select Podcast with your host, Derek Phillips. Always stay up to date on social media at Mentor Select and online at mentorselect.com. Here's your host of the Mentor Select Podcast, Derek Phillips.
Welcome to the Mentor Select Podcast, episode 30, the Big 30. February has been a good month for me as we celebrate Black History Month. Last Friday, I had the opportunity to speak at the Crawley Collegiate Academy, their Black History celebration. It truly was an honor talking to the students, sharing with them my journey, the ups and downs, spotlighting all of the sacrifices that our ancestors have made in order for each of us to have the opportunities available to us today. The funny thing about it, when speaking to the youth, they certainly will make you feel old because I graduated in 2002, and a lot of the students that I was speaking with were not even born in 2002. So just let me know how old I am. But I certainly enjoyed that privilege. And I remember being in high school when speakers would come to our school and share their stories with us, just thinking about, hey, I would love to do that one day. So it certainly is just very fortunate to have that opportunity to fulfill that prophecy and essentially just pay it forward. And that's what it's all about, getting that experience, accomplishing things, and then going back and helping others do the same. If you have not had a chance to subscribe, like, review, and rate the Mentor Select Podcast on iTunes or whatever platform that you listen to podcasts, please do so, because that helps grow the channel, the Mentor Select community, and just helps us reach more people who could use quality virtual mentorship. In honor of Black History Month, this is a special episode where I get to spotlight trauma surgeon Dr. Brian Williams. He is someone who is doing phenomenal work to increase the opportunities available to African Americans, especially in the field of medicine. Dr. Brian Williams is committed to mentoring and just ultimately paying it forward to help others achieve the level of success and greater success than what he's achieved. So it's truly inspirational to hear his journey and the proactive role that he is taking to improve race relations in the United States. Many of you may have seen Dr. Brian Williams on the news or different programs talking about his experience operating on the doctors who were shot in Dallas in 2016. And essentially that event launched Dr. Williams into the national spotlight to speak on the topic of race relations and discrimination and all of those important but oftentimes difficult topics. And what I love about Dr. Brian Williams, one of the many things, is he's so masterful at talking about difficult topics like race and discrimination, and being able to approach it from a solution-based perspective, where it's not about pointing fingers, it's not about blaming, it's about, okay, this is my experience, this is the experience that others have had. What are we going to do about it? How can we improve race relations in the United States and ultimately in the world? So especially for Black History Month and in this climate that we're in the United States, it's very important to approach race relations from a solution-based standpoint instead of blaming or trying to shame people into changing their perspectives and values and beliefs. You really have to meet people where they are, try to understand their perspective, and then collaborate, open those lines of communication to make a real change, to hopefully change their behavior, change their perspective in a positive way. And that's something that Dr. Brian Williams is traveling all around the world, speaking on that topic, to open those lines of communication to really help people understand where he's coming from. And then also he's taking the time to understand where they're coming from and working together to find a solution. So I hope that inspires you all to do the same. It certainly inspires me to do that. And that's what real change is going to occur under those conditions versus blaming and criticizing and just the non-productive way a lot of people address race. Well, I'm not going to keep you all waiting any longer. It's a phenomenal interview, so let's get to it. Today we have Dr. Williams on the Mentor Select podcast. Welcome, Dr. Williams.
Darren, thanks for having me.
It's a pleasure to have you. We always like to ask our guest mentors to share more with us as far as a fun fact that most people don't know about them, just so we can get to know you better.
Yeah, so a fun fact about me that most people may not know or probably don't know is that I'm a huge metalhead. I love metal music. I'm a child of the 80s, so I was really into all the hair bands back in that day, but also new wave of British heavy metal like Iron Maiden and Judas Priest. And that's something that's kind of carried with me through this day. So I think that surprises people when I tell them that. But just as a caveat, I have a pretty eclectic taste in music. But my go-to is if I'm just in the mood, I just toss something in. Then that's usually something, hard, rocking, a lot of guitar, a lot of drums, and a lot of anger.
That helps you get into your zone.
Yeah. That's my study music,
Yeah, I wouldn't have guessed that myself. I wouldn't say I've got much into metal, but I kind of like a little rock and country. My wife, she's a little more one-dimensional. She only likes like hip hop and R&B, so she laughs at me when I'm jamming out to rock and roll.
Yeah, but what I like about the music is that I don't know if people realize that the roots of all, rock and metal, like the roots of that comes from Black musicians from back in the day and how that music was appropriated and evolved. And then you put, on top of that, the mass marketing and all that stuff, and music becomes segregated, right? There's white music and black music. Right. But in reality, music is just music. If it moves you, it doesn't matter what your color of your skin is. So what gets you going is what gets you going.
Yeah, I totally agree. It has the same roots. So Dr. Williams, what's your role?
So I'm a trauma surgeon, and I probably should explain what that means to, listener who may have no idea, not in medicine, or have no idea what that is. So right. a trauma surgeon is a surgeon who manages, treats, and cares for anyone that has some sort of acute injury, whether that be by intentional violence or unintentional. For example, intentional violence would be, the gunshots, the stabbings, intimate partner abuse, something where someone is intentionally trying to hurt another person that results in an injury. Unintentional violence would be like you're in a car accident, or maybe you're at work and you got injured in the workplace, or you're playing sports, you get some sort of injury. So some sort of unintentional injury. And these injuries, we divide them into things that are life-threatening, limb-threatening, and non-life limb-threatening. So as a trauma surgeon, we are trained to manage the entire patient that comes in with these sort of injuries. But beyond that, the reality is that trauma surgery is a small fraction of what I actually do. I'm a general surgeon by training. So my residency was in general surgery, where you learn how to operate in the abdomen, like, on the small intestine, large intestine, taking out gallbladders, skin and soft tissue, such as breast cancers, skin cancers. And so that was my surgery training. And then from there, I specialized in trauma and critical care. So, I forgot to mention critical care also. So I talked about the trauma surgery, which is taking care of acutely injured people. General surgery, which is the elective planned stuff like gallbladders, lumps and bumps. And then there is the critical care part of what I do, which is in the intensive care unit, which is where the sickest of the sick are kept in the hospital. When you think of people that are on life support, that's where they are. Okay. And that's my part of what I do. So I have two board certifications, one in general surgery and one in surgical critical care.
Wow. Sounds like a lot of schooling.
Well, it's a lot of training. The pathway to that is 4 years of medical school. Well, you have to get an undergrad degree. So 4 years of college, maybe 3 if you're super smart and get through quickly. But some kind of undergrad degree, then 4 years of medical school. And my specific path was I did 5 years of clinical training in general surgery. And during that time, I added on another 2 years to do clinical research. So that was 7 years there. That made me, so after medical school, I'm a doctor. After residency, I'm now a surgeon. So then I went and did 2 more years of what we call fellowship training to learn 1 year. 1 year was trauma surgery, 1 year was critical care. So at the end of all that, I am now a fully trained, double board certified trauma and critical care surgeon. So what is that? 4 years of medical school, 7 years of residency is 11 years, plus 2 more years of fellowship, that's 13 years. And if you add on your undergrad, that's 17 years. And I know it sounds like an onerous journey, but the reality is after med school, well, actually starting your third year of medical school, most of that time is on the job training where you are doing the things where you learn how to be a doctor. You're in the hospital, you're going to clinic, you're seeing patients, you're getting in the operating room. So you don't sit in class studying the books every day for 13 years. So don't get that idea.
That puts it in context.
Right.
What type of skills would you say makes a good surgeon?
Well, that's a good question. And I'll start with just what would make a good doctor or anyone in the healthcare field, irrespective of if you're a nurse or tech, family medicine doctor, obstetrician, or surgeon. You have to care about people and be willing to interact with complete strangers who may or may not trust you, but come to you in a time of need and are expecting you to treat them with humanity and respect. And, that may be difficult for some to be that vulnerable with someone they don't know. So you have to have that skill that you're willing to communicate with these people, but also recognize their humanity and understand that, they're coming to you for help. Now, specifically to be a surgeon, I think there's some obvious things like, having good hand-eye coordination and dexterity. So you know how to cut and sew and take out things and put things back together. But that's something that you can learn during your training. I don't feel that there's anything special about learning how to do that. I can teach you how to ride a bike. With enough time, I can teach you how to operate. But there are other more cerebral skills that are important, like how do you decide who needs an operation and who does not need an operation? Because that is a challenge. You don't want to operate on someone that doesn't need it. And how do you synthesize all the information you have from what they've told you about their story and the lab tests that you've done and the imaging you've gotten, who needs an operation? So there's that cerebral aspect of deciding what to do and what not to do, which is something I really enjoy.
Okay. Yeah, when I think of surgeons, I guess I can compare them like the fighter pilots of medicine. Elite of the elite.
There's the trauma surgeons are the fighter pilots there. Just get it straight, right? No, but there's a lot of comparison of medicine to, elite military forces. And I think that's typical of many specialties, many non-military specialties, right? They say we are like the Marines or we are like the fighter pilots.
Right.
There's certainly within medicine a lot of, I say, good-natured ribbing of different specialties, how people talk about surgeons or internists or obstetricians. That comes with, a legacy of what these specialties represent stereotypically. Right. And, we joke amongst ourselves about what that means. But, some people can take it to an extreme where it becomes not funny anymore. But, I recognize that surgeons are held in high regard within medicine, but also amongst the lay public.
Rightfully so, certainly. Becoming a surgeon, was that your childhood career aspirations?
Absolutely not. When I was a child, I had no plans to become a doctor. And when I decided to go to medical school, I went when I was 26 or 27. So I was what they still call a non-traditional applicant. So going back to childhood, I went to the Air Force Academy as an undergrad, and my major was aeronautical engineering. So I spent 6 years in the Air Force active duty, using my degree in engineering, working on military research and development programs. Okay. Becoming a doctor was the furthest thing from my mind. I held doctors in the highest esteem, never aspired to be that myself. And I'm not sure what your experience is like, but I can't remember ever seeing a Black doctor throughout my childhood. I mean, I may have, but none that I can remember. And if I did, I think that would have left an impression upon me. Right. But when I was in the Air Force, my social circle included a lot of nurses and doctors. So I became interested in the field just by listening to their stories and hanging out with them and hearing about what they did, I thought, yeah, that'd be a cool profession. But, I didn't prepare for it. I was not a pre-med in college. I had no concept of what it meant. I had no concept of the pathway to become a doctor. But a chance encounter with a friend of mine who had the exact same background as me. He was a graduate of the United States Air Force Academy. He had a degree in aeronautical engineering. He was doing research and development testing at the same base where I was. And he said, yeah, my next step, I'm going to go to medical school. And that stopped me. I'm like, really? How can you do that? And I talked to him, got some information, and learned that I basically had all the prerequisites to apply to medical school.
Wow.
There's 4 or 5, and this is important for anybody out there that's thinking about going to medical school or wants to become a doctor. You think about pre-med being this, I don't know, something that this ominous degree you have to attain to become a doctor.
Right.
But pre-med just boils down to there's about 4 or 5, maybe 6 core courses you need to have. Biology, chemistry, physics, English. It's been a while for you, Derek. So it's been over 20 years, but there's a few core courses.
Sounds about right.
And then beyond that, you can major in anything you want. So you can major in history or English literature or chemistry, biochemistry, physics, engineering, art, philosophy.
Wow.
So there's a spectrum of undergraduate degrees you can attain as long as you hit these few core courses. Now, most people are, I'm assuming I would say most people, I don't have the numbers, but I assume most people are pre-med. They're majoring in the sciences like chemistry or physics or biochemistry because that's a path that can prepare them for medical school. But that is not necessary. So once I realized that I had the prereqs already, because fortunately the academy core curriculum is pretty extensive and we all take these same courses, I had the prereqs. So for me, it was just a matter of, okay, I want to do this. Now the next step is getting into medical school. And there's this thing called the MCAT, which is the Medical College Admissions Test. And that is the one barrier that I think most undergrads, fear and are preparing for that one test. It's like the GMAT or the LSAT or all those other type of tests that you need to take to get into your graduate degree programs. For medicine, it's the MCAT. And this is back in the mid 90s, before the internet that we know of today. So I just went to the bookstore. I bought this book called, MCAT preparation book, something like that. It was about 3 inches thick. And I spent a year going through that book cover to cover. I did every question. I read every answer, everything I got, when I got it right, I read the right answers and the wrong answers. So that was my preparation, was just going through that book cover to cover. And then from there, I went and took the MCAT. The next step after that is just waiting for your scores to come back. You're good enough. Then I applied to medical school.
Cool. You like say it was literally a chance encounter. And
it really was. It was just, I think about that. If we had not been talking, we were at the bar too, having a beer and just shooting the breeze. And then it came up out of nowhere. I'm like, I stopped like, what? Okay, let's talk.
Wow.
Which I think that's important for your mentor and your mentees to recognize that any encounter that you have can change the trajectory of someone's life. So you and I, we meet people, we never know what sort of impact we may have by the words we say or what we do. And the willingness to talk to someone on the phone for 5 minutes or, respond to an email can give them information that they may not otherwise have or motivate them to do something they did not think possible. And your podcast is a perfect example of that. People are listening to this and they are hearing from so many different backgrounds of people. So I listen to your podcast, so I'm impressed. And somebody may hear that and say, you know what, I want to do that. And that could change their life.
I totally agree. I've had similar experiences with my mentors where it just altered the path of my life for the better. So it's powerful.
Right.
So for those people that's listening who are not familiar with the Air Force Academy, like you mentioned, it's pretty prestigious school. It's hard to get into the Air Force Academy. What initially attracted you to attending the Air Force Academy?
Well, you asked about what I was going to do when I was young. I always knew I would attend a service academy. There's West Point, there's the Naval Academy. Those are probably the most, they're hundreds of years old. They're well known, well established. There's the baby of the bunch, the Air Force Academy, but there's also the Coast Guard Academy and the Merchant Marine Academy. So there's these different service academies throughout the country. But I think West Point Naval Academy and Air Force Academy are probably be the most well-known. Not to put down my Merchant Marine and Coast Guard Academy brothers and sisters. But the reason I knew I was going to go to the Services Academy is I come from a family of veterans. My father was in the Air Force. He served 23 years, enlisted. I have aunts and uncles and cousins that have served in all branches of all branches of the service: Army, Navy, Air Force, Marines. My grandfather served in the Army. My great-grandfather served in the Army. They served in World War II and Korea. So there's this legacy of military service within my family that goes back generations. And with my father, just growing up on military bases and traveling around the world and just being immersed in that military lifestyle, it was never a question to me that I would not go to a military academy. Now, I did apply to other schools as a senior in high school, and I accepted to MIT. I visited there at that campus, some other schools. I was going to go into engineering. So I applied to all the big engineering schools across the country. But in the end, chose the Air Force Academy for a few reasons. One, I was really into airplanes. Two, the Air Force was something I knew just based on my experience growing up.
Right.
Three, I chose the Service Academy over the other schools because it was something different. There was more of a challenge. There were things I was going to get to do while there that I could not do anywhere else. You're ex-Army, right?
Yeah.
So you can appreciate what it's like to be in the military.
Definitely. I got at 19. Just turned 19, stationed in Germany.
Yeah.
I would have never got to do that otherwise.
Right.
It was a great experience. That's impressive. Like I say, accepted MIT as well. So have you always excelled academically?
Yeah, I was always a good student. As long as I can remember. I don't say it came easy to me because I worked at it, but I excelled at school from the start. I just remember from the earliest ages being singled out as that kid, the smart kid. And, especially when you're a young Black male, that the spotlight is on you even more intensely when you're excelling in school, because there are competing social pressures based on your gender, being Black and, you're acting smart. You're trying to be white. You're not hanging out with us. You're not Black enough. So there's all those other things that come with growing up a kid that's not quite fitting in anywhere, but able to move back and forth between these different worlds pretty seamlessly, which I think may have helped me as I got older and how I interact with folks, and I'm able to get along with most people despite any differences I may have with them, whether it be race or political ideologies, things like that. But I'm grateful for that experience.
Yeah, it's an invaluable skill. That's one thing I value about being in the military. Certainly, really just exposed you to so many different cultures and races, and just it's really diverse organization. So it teaches some valuable skills. Where I grew up in Gary, Indiana, was primarily Black. So I definitely can relate to those competing social pressures where I always say, like Black boys, it wasn't cool to be smart.
Right.
But like that's frowned upon, which is so ironic. But Black girls, it's fine. They can be smart and still cool. But the Black boys, it was a different story. As far as like seeing Black doctors growing up, I don't remember seeing many. And like you say, you didn't see many either. Is that something that you've seen has changed in 2018, or is that something where it's still kind of a low percentage or Blacks are underrepresented?
Yeah, representation of African Americans in medicine is something that is an issue I spend a lot of time addressing. And I'll just tell you one fact, which when I learned this, I was actually shocked to hear. So in 1978, there was around 525 Black men entered medical school. Now that number may be off by 2 or 3, but it's around, mid 520s that entered medical school. In 2014, that number was about 515.
Whoa.
So there's several things about that are concerning. One is that the number has dropped in the intervening 30 years, despite there being more medical schools and more medical school positions, you would think that the number of Black men would, also increase. Maybe not
Right.
Linearly with the schools, but there would be more now than there was back in the 70s.
70s, yeah, you would think so.
Where are the Black men in medicine? And we talk about medicine, there's issues with representation across many races, and you talk about gender and gender identity. But, for me as a Black man who does not recall seeing any Black physicians growing up and wanting and recognizing the importance of having diversity in medicine, how that impacts patient outcomes, the need to increase the number of Black men that are entering medicine and going into the field, I think it should be a priority within medical education. We know that there are patients who are treated differently based on their race. We know that having increased representation brings more ideas to the table about how to improve patient outcomes. And so this, diversity within medicine, but also equity as far as who's at the table making decisions about who gets into medical school and whether they go to their residency and their fellowship. That's important. So one is getting more Black men interested in medicine, getting them into medical school. But then when all is said and done, how do we move them into positions where they can have substantive impact on the future of medical care? Because there's been numerous studies that show that diversity within medicine improves outcomes. But it's also been shown in business as well. It's not just medicine. Fortune 500 companies, like any other large organization, diversity in representation, diversity in leadership, diversity in thought improves outcomes, whether it's patient outcomes, profits, employee retention, engagement, just list it. It makes things better. So I consider a personal mission of mine to do what I can to lend my time and efforts and mentorship to help reverse that trend.
Great. And I think it's important just you being that face and people being able to, young Black boys seeing, okay, there are Black surgeons, there are Black doctors. Just that alone goes so far as far as giving them that ambition to follow in your footsteps. Same impact like with President Obama when he became president, just being able to see that it's possible.
Exactly.
That's powerful.
I mean, I'm glad you mentioned President Obama, because it is impossible to quantify the impact he will have on future generations, right? Doesn't matter what your race is. People have seen a Black president. They've seen a president who has conducted himself with honor and integrity and for the good of humanity. And that is something you cannot unsee, you cannot unlearn. And the children that grew up during the Obama years are going to take that ethos with them as they move forward into the world. It's a proud moment to be alive. I can't put it really into words,
Like you said, can't quantify it. We just know it's a big deal.
But also, when you see that, it inspires me to do what I can to improve the lives of those coming up behind me, to show that I care about them as people and what they can contribute to humanity. And if in some small way I can impact someone, you never know what the ripple effects of that will be.
Yeah, I totally agree. And I can tell that's something that's a core value for you as far as, like, say, treating people with humanity and respect. That's something that's often overlooked, but it's critical.
Right.
How have mentors impacted your life professionally and personally?
Oh, yeah, I got to be very clear. I didn't get to where I am by any singular effort of my own. There are a lot of people who have impacted the course of my life, some in small ways that they may not even realize. And if I could thank them all, I would. And there are others that really stepped in at key moments that, made a very directed effort to provide me assistance or guidance or advice when I needed that. Now that I'm older and wiser, I recognize that I didn't adequately thank everyone along the way. And if I could, I would. And the reality is most people don't always expect some sort of acknowledgement.
Right.
But it's nice to be acknowledged, right? And the message there for everyone is that you never know what you're saying, what you're doing, how that will impact the trajectory of someone's life or their career. And there are countless folks who share in my current successes, right? They're the reasons that I'm here where I am now. They're the reason why I get to sit here and talk to you about how I got here. And so I feel it is, my obligation to pay it forward by, looking back and say, okay, who's coming up behind me? How can I help them? Is it a phone call? Do we meet in person? Do I write a letter of recommendation? Do I just, send a quick, response via email? Something I can do that can help out someone behind me who may not know where to look or where to go or even what questions to ask. So, I'm constantly thinking about what can I do to pay it forward because I've been given a lot and it's time for me to share that with others.
One of my favorite scriptures is to whom much is given, much is required.
Exactly.
I'm certainly living that. And in reality, like I said, most times mentors don't expect necessarily a formal thanks, but knowing that you've succeeded and then that now you're looking back and paying it forward, that's thanks to them. That's a representation of they know they played a part, that process, that cycle. That's awesome.
Right.
So Dr. Williams, what do you find most rewarding about being a doctor?
The thing I find most rewarding about being a doctor is being able to share in the humanity of people who I would otherwise probably never meet in any sort of circumstance. Being able to render care and comfort to patients who come to you sometimes at the worst moments of their lives seeking help, and you're able to be there for them and say, I feel what you're going through. I'm here to help you. You're my priority. And those moments where you get to share the humanity of strangers is something for me that is personally gratifying, but also I feel is a moral imperative. It's my duty to serve society. And it's priceless. You can't put a price on that.
Yeah, can only imagine, certainly. And have a long history of service, from the family of military to serving in the academy to active duty. Now as a surgeon. It's awesome. I know you host a race, violence, and medicine radio show, and you've entered into the world of public speaking as well. What's that experience been like?
How to describe it? It's been a transformative experience. I feel it is an extension of these topics we talk about as to how I pay it forward to society. So in regards to the, race, violence, and medicine, which is, that's now my podcast, Race, Violence, and Medicine. I interview guests and talk about, I want to have constructive dialogue about these topics at the intersection of race, violence, and medicine in an effort to get people thinking and inspiring them to action. And, we don't shy away from difficult topics, and the people I have on my show are not always people with whom I agree with, but I think it's important to have those discussions and share it with listeners and let them be a part of this discussion and also make informed decisions. The public speaking, that has allowed me to interact with the largest segment of the country with whom I would never have crossed paths with. And also by doing so, I get to spread this message about shared humanity and talk about the difficult topic of the legacy of racism in this country, and they describe how, we live in a racialized society. It does not mean that everyone has racist intent. However, we have to talk about that in order to make progress towards reconciliation. So, I speak at a variety of venues, whether it's medical centers or churches or schools or industry conferences. I'm comforted by learning that there are people out there that are admitting their blind spots and want to engage in this conversation. And I've also learned a lot for myself that I can take back into my personal and professional life. So it's been a two-way street, and it it's ongoing. I'm still continuing to speak. It's challenging. Just sometimes topics are challenging, but like I said, I feel it's an obligation to step into that discussion because the run from it will not lead to progress. And so, the podcast and the speaking, they serve each other, but they also are an extension of who I am and what I'm about. It's not something it's not something that I am fabricating or a persona that I'm assuming. That's me. You listen to the podcast, that's me. I'm not trying to be somebody I'm not. When I come speak to you at a conference, what you're getting is me. It's not, this is the public Dr. Brian Rich Williams. And when I go back, that's not how I am. So it's allowed me to no longer compartmentalize my personal professional values. They all are kind of existing out in the public in different spaces, but not isolated from each other. And I'm enjoying it. I actually enjoy the podcast. I get to meet these people and talk to folks who are willing to share their stories with me. Sometimes, personal details, knowing that they'll be heard by, I don't know, maybe someday thousands of listeners. Not there yet.
This takes a little time.
Yeah. But I'd say, your listener, raceviolencemedicine.com is where you can listen to the show, or you can, anywhere you get your podcasts, it's available. And I do mean anywhere. Apple Podcasts, Google Podcasts, Stitcher, Spotify, anywhere.
Yes, certainly. I would recommend people check it out. Have some really impressive guests on there. Some people in high places. I feel very lucky. I feel fortunate to have those opportunities. But like you said, it's a conversation. Having that open dialogue, whether you agree with the person or not, is important, and that's what leads to change and people shifting their viewpoints. So I think what you're doing is very important. I had the opportunity to listen to one of your, you had a speech on YouTube from, I think you spoke at the Air Force Academy. That was a really good keynote speech, and just how you share some of your historical experiences with racism, but just the way you do it, it's in a respectful, tasteful way where it allows people not to shut down, but still to hear you out and then really self-reflect and potentially change their viewpoints.
Yeah. Thanks for saying that. The Air Force Academy has an annual leadership conference where they have a variety of speakers come in. And I was fortunate enough to be invited 2 years ago to speak on this subject. And I think the importance is just being authentic about your experiences and what you were trying to achieve with the audience. I try not to preach, but I try to tell the truth. I feel I'm getting better as I go along. But again, I just this is the reality. It's the reality of my existence, which I'm sure mirrors many others that have been in my situation. Right. So the question is, what are we going to do about it? Mm-hmm. And when I say we, what are you going to do? What am I going to do? Yep. And it's just, I just want to plant that seed at a minimum, but at best, when they leave, that we'll do something differently from that point on.
Love it. Like I said, it's a difficult topic. People a lot of times they don't want to talk about race. And the way you do it, it's not necessarily just pointing fingers. Like you said, what are we going to do about it? It's going to take all of us to make that change.
Right.
And to really shift it. So, yeah.
Right.
I certainly keep doing what you're doing. It's important work in addition to saving lives.
Well, I appreciate it. I'm not the only person in this space, right? There are a lot of folks out there doing the same thing. A lot of folks out there working in medicine, a lot of folks out there working towards racial reconciliation in this country. But, no one person can do it all. But if we all do nothing, nothing will happen, right? So I'm carving out my little piece and doing what I can.
Yeah. Great. That's awesome. All right, Dr. Williams, as we get ready to wrap up this show.
Dash, man, I've enjoyed this. Thanks for having me. I'm glad we were able to get this set up, and I'm glad to meet you.
I'm happy as well. I'm looking forward to continue to develop our friendship and learn from you along the way. So, Dr. Williams, do you have any parting words of advice, especially for anyone who's listening who is considering a career in medicine? Yeah, if you're considering a career in medicine, I will say that it is a career that has rewards like no other. The human experiences are difficult to quantify, impossible to forget, and
hard to achieve in any other profession. The things you do on a daily basis can have impact for people's lives, but also generations, because it may impact their families' lives and their friends' lives. So that gratification from having that sort of impact is extremely rewarding. So the road there is lengthy and challenging, but at the end, you will be ensured of a lifetime of learning and positive impact on humanity that will be worth the journey. And like I tell you, Mentor Select, I like to mentor, so I am happy to connect with your listeners. They can follow me on Twitter at BHWilliamsMD. They can send me a direct message. Anybody can. My website is brianwilliamsmd.com. That's Brian with an I. And you can shoot me a message there, email me. You can follow the show, raceviolenceandmedicine.com, see messages there. And I'm going to do one more thing, Derek. I'm going to give up my cell phone number.
All right.
214-699-8730. That's 214-699-8730. I'm happy to connect with anybody and give the advice that I can. And if I don't have an answer for you, I will try to find someone who does.
Wow, that's a man dedicated to mentoring. That is incredible. Awesome. We really appreciate it, Dr. Williams. It's certainly, you're the first doctor we had on. That's such a first surgeon, Black surgeon. Oh, wow. Double honored. I really appreciate it. Hope you and your family have a happy holidays.
Same to you, Derek. You have a good one. Look forward to catching up again soon in person.
Definitely. I'll see you soon. Thanks, Dr. Williams.
All right. Take it easy.
Wow. That was an incredible interview with trauma surgeon, Dr. Brian Williams, also activist, public speaker, podcast host. He does a lot. So just when you may think that you are too busy or don't have enough time in the day, hey, think about Dr. Williams and all the great things he's doing. He even shared his telephone number. That's just how committed he is to mentoring and paying it forward. So that truly inspires me to do more. Be sure to check out the Race, Violence, and Medicine podcast. You can listen to that on all platforms. And certainly reach out to Dr. Brian Williams. Let him know what resonated with you about this interview. And if you know anyone who wants to be a doctor, aspiring surgeons, or any career in medicine, certainly reach out to Dr. Williams. He's willing to put you in touch with the right people or give you any career guidance that you may need. As he mentioned, it can just be a chance encounter that can change the trajectory of your life. So certainly take advantage of that opportunity. We can't thank Dr. Brian Williams enough. He's an awesome guy. He has really high values and standards, and he's trying to change the world, and he's certainly doing his part. So we have to do our part as well. Remember to like, share, and review the Mentor Select podcast on iTunes or whatever platform you listen to your podcast. You can also listen to it directly at mentorselect.com and just share with your friends and family. Let them know that, hey, there's quality virtual mentorship out there. So there's no excuses. Well, other than that, I'll be back next week with another phenomenal guest mentor. So be sure to tune back in. Thanks for all of your support.
Thanks so much for listening to this episode of the Mentor Select podcast, helping you identify and follow your passions. For more great content and to stay up to date, visit mentorselect.com and Mentor Select on social media. If you enjoyed today's episode, please rate and review. We'll catch you next time.